Totally.
We have 4.2% of the population. We consume 50% of the world's pharmaceuticals.
Yeah.
And we're spending like $4 trillion a year managing disease. And I'm like, this can't be good. Pain down the arm, up to the left jaw, shortness of breath, sweating, feeling a little faint. So I called my friend. I told him what was going on. He said, pull over. This is, you're having, so I'm going to call you an ambulance, tell me where you are. I had rising troponin, which is a sign of a heart attack.
Okay.
Yeah. They checked it a number of times, which is how you diagnose a heart attack. The heart throws off this troponin when it's dying. They wake up in the recovery room, and I was like, what happened? I just assumed I'm like full of plaque, totally blocked, squeaky clean. Not a shred of any plaque in any artery.
What?
It was microvascular. It was entirely microvascular because the big arteries, he checked them all.
They were fine.
Squeaky clean. And she says, oh, well, I have this device that may help you recover. She says, get on the table. And she turns it on. And within a minute, I was so relaxed. Never forget. I mean, what the heck? I was just, and I'm not a stressy person.
Yeah.
But I just went to a deep peace. She started asking me questions like, just give me a minute. I'm like, so relaxed.
Okay, everyone, welcome back to another episode of the Longevity Lounge. My name is Ben.
And I'm Caylee.
And we have a wonderful guest with us today. Welcome back, Dr. Michael Gaeta.
Great to be back, you two.
Yeah, and it's great to have you in the studio as well.
Yes, it's fabulous.
Yeah,
this
in person.
Beautiful. I love the in person.
Yeah, me too.
Yeah, it's
We've got a great conversation today. We're going to be jumping into really kind of the details of microcirculation, some of the systemic effects of microcirculation, some of the hidden and unexpected benefits of taking better care of it.
Yeah.
And how we can utilize things like PEMF to improve it and give us the life and vitality that we're really after. So let's jump in, shall we?
Yeah, let's do it.
So let's start off. Let's begin with the basics, because I'm mindful that we've got some repeat listeners, but also people who maybe listen for the first time. So tell us first off, many people have heard of obviously our circulatory system, but a lot of people are not as aware or informed about the role of microcirculation. Tell us the difference and kind of the primary function of microcirculation.
Yeah, that's a great question, Ben. So the circulatory system in general is what delivers the good stuff and drains the bad stuff.
Yeah.
And most of that action happens in the tiny vessels. So we have 30 to 38 trillion cells in the human body, and every one of those cells has to be right next to a blood vessel, so a capillary. So we have the big vessels that we're familiar with. You can see your veins here, and you can feel your artery here. And those are the big guys. And that makes up about 26% of the total circulatory system, which, by the way, is debate. There's conflicting opinions on this, but how long it is, like total length, if you lined up all your blood vessels, it's somewhere between 70 and 100,000 miles.
That's
insane.
So your blood vessels, if we stretched them all out in line, would encircle the Earth at the equator 3 times.
Yeah.
Maybe 4.
I've got little legs, maybe a little less than me.
Has anyone done that? Like what? I mean, that's just the curiosity, maybe. But like, what's the debate? Okay.
Well, some people say 60, some people say 70, some people say 100.
Sure.
And so whatever. I mean, it's a lot of vessels. So so 3/4 of that are microscopic. Can't see them.
Yeah.
And these are so we have the blood leaves the heart, the fresh oxygenated blood that got its oxygen from the lungs, gets into the left ventricle of the heart, pumps it out into the aorta, and then it begins its journey through the circulatory. The heart just gets it started. It's really the microvessels and the smooth muscle activity that gets the blood through the circulatory system. So the business side of the circulatory system are the microvessels. So the arterioles branch off the arteries. They shove blood into the capillaries. That's where the exchange happens. And there are 3 things that get delivered out of the capillary bed into the tissues or cells, which is oxygen, nutrition, and hormones. So those are the 3 good things that go in, basically. And then the bad stuff that comes out is waste, metabolic waste, metabolites, and carbon dioxide.
Yeah.
Which, then that gets dumped into the venules. They gather up into the veins and then end up back in the heart. Heart picks it up, sends it to the lungs, picks up more oxygen, it gets rid of the carbon dioxide, and then it all starts over again. This is an amazing system.
Yeah,
it's wild. Remarkable. It's wild that it just continues to work. I mean,
yes.
Yeah.
Well, you hope it continues to work.
Yeah. Well, it's interesting because I studied biology at high school.
Yeah.
Sure.
Nowhere near the comparison of the various guests we've had on the show, right?
I don't think I got past putting bugs on a poster board, to be honest.
But you learn about the circulatory system there, like in school. But that's 26% is what we're mindful of in terms of the veins and arteries, and versus the microcirculation taking up everything else. So
that's right.
The business end.
That's right.
Of the job, so to speak.
It's where the action happens.
Yeah.
So a lot of the pathology we're seeing is microcirculatory.
Sure.
And that's sort of the renaissance that's going on in many fields, especially cardiology, as they're recognizing how important these tiny vessels are.
Yeah.
Where the focus has been almost entirely on the big, kind of the sexy big arteries. And they're realizing now, hey, wait a minute, we're missing 30 to 50% of all heart pathology in these tiny guys, these tiny vessels. Even in the heart, 90 to 95% of all the blood circulation to the heart is through the microvessels, not the big arteries.
Yeah.
So that's
crazy,
massive.
And you have a personal experience with that, right? You had to learn that yourself. Do you mind sharing?
Yeah, I learned that the hard way. Well, yeah. So I have a family history of heart disease. I held my dad's hand in 2006 in December as he passed away of his second heart attack, and it's a big thing on my dad's side of the family. Heart disease, heart attacks, all this. So anyway, it was 2008. And I think my daughter was just born or was just about to be born. I'm not exactly sure, but right around that time. And she's 16 now, almost 17. And it was a very stressful time in my life, just various reasons. And I started developing, it was going on for a year or two, like chest pain, like what we call angina pectoris, which translates as strangling chest. And that's what the term means, Latin. And so exactly when I saw my dad have every day, I started getting, I'm like, whoa, I'm like 39, and this can't be good. So I'm like, all right, I knew what to do nutritionally and herbally and acupuncture, and it definitely helped. I would chew a few standard process Cataplex E2, and the pain would be gone in 30 seconds, at most. So I was managing it. But it just kept happening. So then one day I saw a patient. I grew up in New York. We had 3 clinics. I ran 3 clinics in Manhattan, Queens, and Huntington, Long Island, and Suffolk County. Beautiful area. And so I had a full day of patients, and then went to I had a house call patient who was homebound. She was so sick, she couldn't leave the house. She would walk out to the mailbox and back and had to sleep for 2 hours because she was so exhausted from that. Really in a bad way. She was, very obese, 350 pounds, and at 5'3", something like that. Oh, gosh. She was really in a bad way. Doctors said, like, we don't know what to do, help you. And a patient of mine who's a friend of hers, she's like, please help her. I think she's going to die. I'm like, I'll try, So I started seeing her every week after hours. So I just had a boatload of patients back to back, and then 11:30 at night I'm going over to this patient's house.
Oh my gosh.
And then I would talk to her and try to comfort her, encourage her, support her, treat her with body work, set acupuncture needles, which usually we leave in for about 20 minutes, and then I would just clean her apartment because she was so weak. Oh gosh. It was just cat hair, her hair, and I don't know if it was cat, it was just her hair was everywhere. Dishes piled up, bugs in the kitchen. It was just, she was living in squalor, which is just not healthy.
Totally.
Yeah.
And so I'd open the windows, to get some fresh air in and just clean the house as much as I could for 20 minutes. And then I'd remove the needles, finish up. And so off I go home. Now it's like 1 a.m. And then about 1:30, I'm like, this is not good. This came up, it was stronger. And then, I've been practicing at that time for let's see, this is 2008. So I've been practicing for 18 years at that point. So I knew something about the body. And I'm like, this can't be good. Pain down the arm, up to the left jaw, shortness of breath, sweating, feeling a little faint. So I called my friend, who is a triple board certified cardiologist, renting space in my office to see patients. And miraculously, he picked up. It's 1:30 a.m. He's like, what's up? He's like, I told him what was going on. He said, pull over. This is, you're having, he said, I'm going to call you an ambulance. Tell me where you are. And I was like, I'm not doing that. I don't want to die on the side of the road while I'm waiting for an ambulance. So he said, get to the nearest hospital. So the nearest hospital was where my dad died 2 years earlier.
Yeah.
So I pedaled to the metal. I'm 120 miles an hour on the Northern State Parkway, just rocketing towards this Lakeville Road exit to get to St. Francis Hospital. And he said, I'll talk you through the ER because you could be sitting there for hours. So he told me what to say. They're like, oh, and he said, ask them for 2 aspirin and chew the 2 aspirin. So I chewed 2 aspirin. All the symptoms were gone within 10 seconds. I'm like, I'm going home. He's like, no, you're not. Stay there.
He's like, I'm not done.
Exactly. So anyway, I had rising troponin, which is a sign of a heart attack.
Okay. Yeah.
They checked it a number of times, which is how you diagnose a heart attack. They don't do it by EKG. It's inaccurate. But rising troponin levels, the heart throws off this troponin when it's dying. So as heart cells are dying, it releases troponin. You can measure that in the blood.
Yeah.
So he's like, you're staying there. So anyway, the symptoms subsided immediately with the aspirin. He says they're going to keep you overnight for observation.
Why does that work?
What's
I'm
that?
just curious. Why does the aspirin?
Well, it's a little black box. We're not entirely sure. It's an inflammation inhibitor, but that wouldn't account for it. It's somewhat of an anticoagulant. That wouldn't necessarily account for it working in 10 seconds, but maybe it does. We're not really sure.
Interesting.
But it definitely clearly affects microcirculation.
Yeah.
Because of what happened the next morning. So
sorry to interrupt you. I was
that's right.
You got to know.
So the next morning, we got to do an angiogram, which is they thread basically a camera with a flashlight up through your groin, up to your heart. And look around. And they'll go in and then look around here, look around there, and they check the big arteries in the heart. And it was very funny. The interventional cardiologist, which my friend was a nuclear and interventional cardiologist and an internist, so he had 3 board certifications. Graduated from Hopkins, Princeton undergrad, like crazy smart guy.
Yeah.
And so he just said, this is what he's going to do. This is like what he used to do before he went holistic. Yeah. So I taught him natural medicine, and he taught me cardiology for those 4 years, those last 4 years in New York.
Yeah.
So anyway, I read the consent form, and it says if I find a blockage, I'm going to put stents in. I'm like, no way. He's like, what are you going to do? I have to do it. I was like, I'm not doing so. Well, what are you going to do? It's like, I know what to do with this situation naturally. He's like, you have to put a stent. So anyway, we're going at it. I'm like, dude, this isn't helping. You're
like, you're raising my blood pressure.
Yeah, we're going at it New York style, getting in each other's face kind of, over this stent thing. And finally, he's like, fine. And I'm like, do I really want this? I just pissed this guy. I'm sorry, I just angered this guy. So I really want him sticking a camera, threading a camera up through my artery. But I didn't have a choice. So anyway, we, my wife at the time was a contract litigation attorney. Yeah. So she's like, okay, I'll show you how to alter the form and edit here, initial there, cross this out, add that, all these all this legalese. Yeah. And he's like, he has to sign an initial it here. You have to sign an initial it here. And then it's done. They can't do anything. I was like, great. He was not happy about that. But anyway, I wake up in the recovery room, and I was like, what happened? I just assumed I'm like full of plaque, totally blocked, squeaky clean, not a shred of any plaque in any artery. What? So I'm like, what? He's like, you're good, basically. He's like, you have no plaque. So I called my friend. I'm like, what the heck? He says you had neurogenic angiospasm, which was basically stress-related constriction of the blood vessels. What he didn't explain, which I really didn't understand until the last few years, was that it was microvascular. I had microvascular angina and possibly what we call a MINOCA, myocardial infarction with clear coronary arteries. So I may have had that. I don't know if I would meet the criteria. I'm going to ask Judd the next time I see Dr. Milhan. Hey, if I had troponin of 7, was that a heart attack or not quite a heart attack? And I'll get it sorted out. But anyway, squeaky clean arteries.
Yeah.
And it was microvascular. It was entirely microvascular because the big arteries, he checked them all.
They were fine.
Squeaky clean, like not a trace of plaque.
Yeah.
Then 2020, this is 12 years later, another very stressful time. And this hand turned purple. I'm like, what? This can't be good. And it was a very stressful time, very intense. And this hand was purple, both sides. Went to see the cardiologist. He's like, that's central. In other words, that's your heart. That's not one of the arteries. If it was one of the arteries in your arm, it would be half the hand. But because it was the whole hand, it came from your heart. I'm like, oh no. So it eventually went away. He's like, you have to get a coronary calcium score right away, which in my practice, in Chinese and functional medicine, I recommend basically everybody do over age 40.
Okay.
At least as a baseline.
And what is that?
It's a CT scan of your heart. Okay. Without contrast dye. There is some X-ray exposure, so there are some clinics that have very low radiation machines like we have in Boulder. Otherwise, you're dealing with some X-ray radiation. It's not something you do every month. But if it's clear, you wait 5 years, 6 years, or whatever the doctor recommends. But if it's real blocked up, you may have to repeat that every year or two. So you follow your cardiologist recommendation. So anyway, he's like, I think you have a blockage there. So I was like, okay, let's find out. 0. The score was 0. And that's it doesn't get any lower. So it's measuring the thickness of the coronary of the calcium in your heart arteries. And plaque is made of calcium. So you can kind of infer that the more calcium there is, the more plaque there is, the more blockage there is. Yeah. So he's like, this is older cardiologist. He says, well, Mike, you're going to die of something, but it's not going to be a heart attack. He's like, no, he said
you're going to die of something.
He said, we all die of something, but you're not going to die of a heart attack. I'm like, but that's not entirely true because you can have a microvascular heart attack. Right. Which I may possibly have had when I was 39.
Right. But they're just not looking
They're not thinking about that. So here's what's happening. So I'm sorry we went to cardiology now. But in the field of cardiology, there's a whole renaissance going on where they're starting to appreciate the importance of microcirculation. Yeah. Because they're like, hey, we've been single-mindedly kind of blinders on arteries, but we're now looking at the tiny vessels that are 90-95% of heart circulation. So the cardiologist, this is going to take years or decades to trickle down into the cardiologist's office, where they're really thinking seriously about microcirculation. And the journal articles, the research articles say, this is really important, but we don't have any tools. Yeah. But now, I know better now, we have the best tool in the world for improving microcirculation. I wish I had known about the BEMER, back then. Because I could have prevented a lot of grief, by opening up the microvessels where I had the problem, because I got clean arteries. So anyway, it was amazing.
So how did you come across then after these experiences? How did you get acquainted with BEMER?
Well, another clinician, colleague of mine in Colorado, Lori Grace Kachiver, is a mental health professional. And our kids were in the same Waldorf school. So we knew each other as school parents. Yeah. And so I just happened to mention in passing, we were at a school function.
You're waving at her in the pickup line with your purple hand. She's like, are you good?
That does take the strong hand. Yeah. Thankfully, that resolved in a few days. Once I saw the cardiologist for the follow-up, that's when I really understood, I got to get this stress thing under control. Yeah. Because all the angina went away. Because in 2008, I had this scary night. I was like, we're out of here. So within a year, I sold my practice and moved the family to Colorado. Well, my chest pain went away. I was just in a less stressful environment in New York City, where I grew up. And so that part was good. But then this period of intense stress happened later. Yeah. And that's when all the symptoms came back. So anyway, so I said, how you doing? So I'm having some, I really ripped up my left knee pretty bad with skiing. I kind of wiped out hard at Winter Park, and with martial arts practices. I was sparring one night and the knee just buckled and couldn't hold it. And this was after a prior skiing injury, which I did not handle properly. I didn't get it imaged.
Yeah.
But anyway, the knee was like a mess.
Yeah.
So I was like, I really don't want to get knee surgery. You know, our philosophy at the clinic is nature first, drugs last.
Yeah.
Let's use the least invasive intervention first, do the most invasive intervention last. So I said, you know, so I saw this orthopedic guy, and then the first stem cell clinic in the country is like 20 minutes away. You know, they started this in the 90s, I think. And so I said, hey, do I have a shot? You know, I want to avoid surgery. Is this possible? He's like, and he carefully checked a million things, and he says, yes, you're within limits. So I had stem cells, platelet-rich plasma, prolotherapy, all this regenerative stuff to help the knee heal itself.
Yeah.
To try to avoid, and it was successful.
Yeah.
So I'm talking to Lori. It was November of 2022, and she says, "Oh well, I have this device that may help you recover, and me prepare for and recover from this stem cell thing." So I was like, "Great, you know." So I'll come to your office. I'll talk to you about it. She explained it to me. I was like, "This sounds really cool." And before, you know, she explained a little bit. She says, "Get on the table." And she turned the thing on. I've been teaching for 30 years, and all over the country, like in every state, in a couple of different countries, and so, you know, attendees, practitioners who came to my weekend seminar for standard process and functional medicine and nutrition would say, "Oh, you got to try the BEMER." And they would say, you got to try colloidal silver, you got to try that. They're just generous, well-meaning people. They're like, "Oh, I love your stuff. Hey, this has helped me. You should try." And they, you know, dozens of recommendations.
Yeah.
This is one of them.
Yeah.
And I was like, "Thank you, appreciate that." And I just sort of filed it away with these other dozens of recommendations, like, "You should try this." And so here it is, you know, and she turns it on. And within a minute, I was so relaxed. Never forget. I mean, what the heck? I was just, and I'm not a stressy person.
Yeah.
But I just went to a deep peace. Like she started asking me questions like, "Just give me a minute." I'm like, so relaxed. By the second minute of my first treatment, this is low intensity treatment, very low settings. I knew I was going to buy one of these because like, this feels great.
Yeah.
And I want everybody else to feel this way too. This feels amazing. So peaceful. So I used it on my knee, and I recovered in like half the time.
Yeah.
And I exceeded all the expectations of the orthopedic guy, and recovered really well. And quickly, the discomfort after the procedure was much less than usual. And it was successful, you know, so it was a good adjunct to that, you know, procedure. And then I started using it for other things. I'm like, wow, this really helps. And I started using it with patients in the clinic. And as I like to say, I became a better acupuncturist overnight. Because patients are like, wow, something's different today. What's different? I'm like, oh, I'm using this pulse electromagnetic field. I was like, wow, this is really. So then I started recommending it to patients.
During acupuncture. Awesome.
Yeah. Get them on the table, turn the BEMER on, do some body work, set needles. That's basically what I do.
Yeah.
And they's like, what's different? And I said, this thing. So I said, well, you know, it seems to be, it's helped me. Maybe you want to get one too. And some of them started like, oh yeah, I'll get one of those. Yeah. And then they're like, thank you. Yeah. I feel so much better. My wife feels better. My kid feels better. Whatever. Yeah. Everybody's like, everybody likes it. Yeah. So I'm like, oh, look at that. So then I'm like, okay, I proved it on myself, proved it on my patients. Now, mostly what I do is teach functional medicine to practitioners, although I have part-time practice, mostly remotely through Zoom and phone and things like that. But some patients come into the office. And I told my students, like, I just found this thing. I've heard about it for decades. But this is very amazing. So some of them were like, all right, you know, Mike likes it, and let's give it a try. And they trust me. You know, they're coming to me for training, and they started some of them started baking it into their chiropractic or acupuncture or whatever practice, and they're like, this is really good. And then their patients are happy. So I'm like, wow, we have 100% happiness rate. So that was kind of how it all started.
Yeah,
that's awesome.
Yeah. Tell me, so help us understand, how does BEMER interact and support acupunctural kind of therapy? That sounds interesting that you've got patients that are immediately going, wow, I can feel a difference here. How does it interact there?
It's the perfect like treatment partner, whatever you do. So I started out as a massage therapist who practiced nutrition and herbal medicine. And went to acupuncture school a few years later and built that in after 6 years. So the BEMER is the ultimate adjunct therapy or support to any form of treatment, chiropractic, body work, acupuncture. And the reason is most issues that people come in with, we would just talk musculoskeletal.
Yeah.
So when I was a massage therapist, I have a sore back, my muscles are tight. Most of that is poor blood flow. It's stagnation. The blood isn't flowing. We call it ischemia, lack of blood to an area, which causes pain, stiffness, soreness, that sort of thing.
Yeah.
So if you can move the blood, bad stuff out, good stuff in, you're addressing the cause of a lot of the things that people come in for. So acupuncture, in part, improves blood flow by working through the meridian system, the channel system, the energetics of the body, these rivers of energy that underlie, that kind of permeate the physical body, these invisible pathways.
Yeah.
By working with those pathways, opening them up, a lot of things get better mentally, physically, emotionally.
Yeah.
But one of the physical things is blood flow improves. And so this is a great adjunct to that. Chiropractic care, the muscles govern the bones.
Yeah.
Right? So you can move the bones and relieve that fixation, that subluxation complex. But if you haven't addressed the muscular tension that caused it, your neck's going to go or your back is going to go out right away.
Yeah.
So some chiropractors will do therapies, heat, massage, whatever, electrical stimulation before the adjustment to make it easier and so it'll last longer. The BEMER does that better than anything.
Yeah.
And chiropractic, some of my students, chiropractors who were studying functional medicine with me, and they're like, wow, my adjustments are easier to do, they're lasting longer, patients love it. So you're addressing the foundational system of the body, because when microcirculation is improved, all the organs work better, all the tissues, everything works better.
Yeah.
So it's a great adjunct to whatever the treatment is. And at a physical level, muscles, joints, tendons, ligament, all those things just, work better.
Work better, yeah. We had Dr. Milhon on a couple of weeks ago, right? A cardiologist. And he was saying that just as a consequence of age, microcirculation doesn't perform as well over time.
Exactly.
So aside from BEMER, where that kind of that pulse electromagnetic frequency stimulates the microcirculatory system and improves blood flow.
Yes.
Yeah. Outside of that, what can we do to improve our microcirculation?
Yeah. Well, the first thing is physical activity.
Yeah.
It's just a basic thing. If the body doesn't move, it just decays. Things get stuck. We have a saying in Chinese medicine from the 1300s, the 10,000 diseases, which is poetic language for like all disease.
Sure.
The 10,000 diseases begin with stagnation. So if things flow, right, that's one of the reasons acupuncture is so great, is that it gets things flowing, which can be very relaxing. A lot of folks are tense and contracted and constricted, tense, and this just, you just relax because things are flowing again.
Yeah.
So, so exercise, so it's just physical activity.
Yeah.
I go back to Jack LaLanne, half hour a day. Preferably outside or whatever you're doing. So physical activity is big. And then and as a nutritionist, I'm very concerned with people's diet. And there are just, things like sugars and processed foods and processed fats, hydrogenated oils, that just, pasteurized dairy products that tend to clog things up.
Yeah.
So clean diet, plenty of meat, healthy, organic, pastured meats, vegetables, fruits, just sort of like what's naturally occurring, without being messed with too much, is very supportive of circulation, especially berries. Berries are really, really good at improving. So there's dozens of studies on it, on a correlation between berries and circulation. Just an example. So I recommend half a cup of organic berries a day.
We found raspberries in our backyard this year, and we were absolutely delighted. We did not plant them. So whoever owned our home before for several years had raspberries, and we were just delighted. So they only last for such a short amount of time, and they are not the size of the raspberries in the store. They're very small, but
for sure,
very organic.
So you got to learn how to can and all that preserving stuff.
Oh yeah.
But I mean, you're kind of tapping into here some critical lifestyle challenges that most of us face now, right? That you talk about stagnation being an issue, and they're saying now that sitting is the new smoking, right? So there's an obvious impact there. Mass production of foods and all of the preservatives and additives, the sugars and all of the chemicals that are just making life convenient but not good. Right? So how does microcirculation and gut health, for example, play a part?
Huge. It turns out that most of the blood flow into the gut. So the gut's role is to, as Bruce Lee says, absorb what is useful. Right, that was his thing in martial arts. So the gut's job is to absorb everything that's useful and to eliminate what's not. In Chinese medicine, this leads to the arisal of the clear. It's very poetic language in Chinese medicine,
I love it.
and the removal of the turbid. So that's a little bit of that. So that's its job. Now, in Western medicine, that gut lining, that permeable barrier between what we eat and our blood, basically, is entirely dependent on what everything else is dependent on, which is oxygen and nutrition and hormones. And so the microcirculation is essential to digestive health. And interestingly, the famous BEMER blood flow video from 2013 from the Institute for Microcirculation in Berlin was looking at a guy's colon. So it was colonic microcirculation.
Interesting.
And that's the other lifestyle thing, Ben, is stress. And I can totally speak to that because I had these 2 crazy episodes. Stress largely constricts microcirculation. And so that sympathetic stimulation, that fight or flight response, the stress response, causes some vessels to dilate, mostly to help you run away from the charging ox, or whatever, ancestrally. But causes a lot of the vessels to constrict, partly to conserve blood where it needs to go, and also to the digestive system. In other words, you have sympathetic fight or flight or freeze, and then you have parasympathetic, which is rest, relax, digest, repair, detoxify. So all that stuff just shuts down. And one of the ways it gets shuts down is cutting off blood flow to the digestive organs. And that's what happened with this poor guy who, like me, was in his late 30s at the time. And healthy guy, fit, athletic, great, no health issues, but he was super stressed. And because he was in a chronic sympathetic dominant state, that stress response, the blood flow to his digestive
it's just restricted.
It's cut off. He's like, you're in a survival situation. Digestion's irrelevant. So this poor guy had like no digestion, and this is what happens typically with people, when they're stressed, digest things well. And so Dr. Klopp found with the BEMER that he was able to restore this guy's colonic microcirculation as evidenced by intravital microscopy within 8 minutes. And it started happening within 2 or 3 minutes. It was a visible change. And in 8 minutes, it was like amazing. 10x, 15x improvement.
And for hours after, right?
And it was a sustained improvement. That's a great point. So the BEMER is remarkable in its ability. And that's the other part of its effects. It's not just circulation. It's also the nervous system. It's that low 10 hertz alpha wave aspect of the signal that's very calming. And I guess that's what happened to me that day in my first session.
Totally.
So maybe that 10 hertz just calmed my nervous system down even more, or I was just not knowing I was stagnant and opened the blood flow, and I relaxed because I had more blood. I'm not really sure, but at the end of the day, it doesn't matter. So this is a remarkable intervention for today's world. Right? Stress, chronic disease, vitality. These are really big things.
Oh man, it gets to the heart of so many common complaints, doesn't it? And you talk about stress, its impact on digestion. And you also mentioned the microcirculation isn't just feeding oxygen and nutrients, but also hormones. Right. So kind of staying on the topic of the gut. We often refer to the gut as the second brain.
Brain.
Right. And is it 90% of serotonin is
about that
kind of produced in the gut, right? So, and that certainly leads to happiness and mood and all that kind of thing.
For sure,
so,
the gut feeling.
So walk us through the impact here with microcirculation then in terms of mental health.
No, for sure.
Is there a connection that we see there?
There is. Well, you identified one of them, Ben, which is the better the gut is working, the better it's able to produce those hormones, and then those substances get distributed better to the rest of the body. So that's like thing one. Thing two is you calm the nervous system to more balance between sympathetic, parasympathetic, and the digestive system just works better in general. The third layer is in the brain, directly in the brain. And there's been a pile of research. It's astounding. I've been digging into this last several months. The medical literature on microcirculation and mental health is astounding. Some researchers are calling Alzheimer's disease a microcirculatory condition.
Wow.
They're just this in Parkinson's, Alzheimer's, dementia, memory loss, problems after head injury are microcirculatory problems. And they're like, this is incredible. Like the correlation is very, very strong. So we know that mental health and even depression, anxiety, poor sleep, they're relating everything to, and this is kind of what's happening in medicine in general. If you just go to Google Scholar and type in microcirculation and then put anything in, any system, any organ, whatever, you'll see hundreds, if not thousands or tens of thousands of studies and papers on this subject. This is the leading edge in healthcare. For sure. So, and we've seen, you and I were at the Scottsdale event, which was amazing. And that lady, stood up who had a terrible car accident and didn't recover until her friend said, well, try this BEMER thing. And she got better. And the doctor's like, what did you do? It's like, I got this BEMER, right? And she just, I wrapped my head. That was her thing, put the beep pad around. And she recovered. Sadly, she got into another terrible car crash. And it was even worse because all the body memory of that.
It was a horrible story.
And then she recovered again. And then, there wasn't a dry eye in the room. This couple telling their story, and the husband says, thank you for giving me, looks at Stephanie and said, thank you for giving me my wife back. I got the handkerchief out. So that's just real world example of what's in the literature. This can all get very theoretical. Oh, this study says that. That's great. But this is people's lives. I mean, we're really impacting people's lives in a dramatic way.
That's so awesome. What are the main, maybe this is just me being curious, but what are the main things that people come to you for? Like, are they just not getting the answers in typical Western medicine? Sure. I mean, that seems like that's the natural way.
Well, it's evolved. I mean, I started practicing 35 years ago. I've been practicing Chinese and functional medicine for that time. And it used to be like, I'm at the end of my rope. I've seen 12 specialists, tried a million I have no other hope. You're my last hope. Kind of like Obi-Wan Kenobi. You're my last hope.
It seems like it's flipping, though.
But that's what I'm saying. That was 35 years ago, 30 years ago, 25. But now, last 5-10 years, people are like, I don't want to go through all that conventional stuff.
Totally.
Let me go, and this is why our motto at the clinic and the school is nature first, drugs last. People are starting to think that way. Like, before I go, and this is different. Before I go see all the specialists and the drugs and the procedures, let me try something less invasive, more restorative, supportive, natural. And so that's the change. I mean, basically my practice is a family practice. And so I've kind of seen everything just about that you could name. But I would say mostly the folks that come to me have cardiovascular, autoimmune, cancer issues, digestive issues, respiratory, things like that. Although, again, that's a generalization. I've seen, I can help anybody. And especially even better now, that the BEMER, it's even better. So, that's just been the general practice. But there has been a cultural shift, which is great. So
it seems like it.
And actually, Eisenberg's study from 92, so this is 33 years ago. Back in 92, they found out that people were visiting folks like me more than they were doing office visits to conventional physicians, which was a huge. And now it's like, it's exploded.
Totally.
So it's not even close now. The number of visits to natural practitioners far exceeds standard medical visits, which is good.
Yeah.
Because the medical system, it's kind of broken, and it's great for trauma, emergencies, life-saving intervention.
Totally.
I was really glad for the ER that night.
Yeah, 100%.
It was great.
100%.
And when I was an avid cyclist back in the day, and I fell, broke my arm, broke my shoulder, bleeding. So I was happy for the ER that day. But for chronic disease, for prevention and wellness care, quality of life care, it's not their training. It's not the doctor's fault. I mean, many of these folks are my students or colleagues who come to me to learn functional medicine. And it's not their fault. They're just stuck in a broken system.
Totally.
And so a lot of them are like, this isn't working for anybody. So I want to go natural. What can I do, non-drug wise, So there's been a culture shift.
I think a lot of people don't know either. I mean, it's obviously starting to change a lot now, but like I danced in college and had my first knee surgery when I was 19. And it never was occurred or presented to me that, hey, maybe there's something we can do before surgery. And of course now I'm like, oh my gosh, the fact that I had knee surgery when I was 19 just makes me sick. But and it's fine now, but it doesn't feel like that was, however long ago that was, 9-10 years ago. That doesn't seem like that was presented to me as kind of a first option of maybe let's try to, fix something, see what we can do. I would have loved to have a BEMER. I would have loved to have a B pad to wrap around my knee and try to, regenerate some things going on in there before going under a knife. But it does seem like the culture is changing a little bit where people are starting.
But it's a great point, Caylee. It's coming from the bottom up.
Yeah.
In other words, the doctors are not, the physicians are, because they're not trained to, for whatever reason, they're not saying, hey, you should go see an acupuncturist.
Yeah.
They're not saying that. They're not saying, oh, you should get a BEMER. You should have some body work, some chiropractic care. Yeah. It's just not what they do. It's not their fault. But they're just, it's not what they're going to, so where those things like, oh, get a BEMER for your knee, that's coming from like person to person.
Yeah. Yeah.
So it's people saying, oh, maybe try this, maybe try that. That's where a lot of this is coming from.
Totally.
Because it's, it's not going to readily happen if we're waiting for the medical profession to go holistic. It's starting to happen. Yeah. But it's really, as I said, it's a groundswell. People are just sick of all drugs all the time. Totally. We have 4.2% of the population. We consume 50% of the world's pharmaceuticals. So that's just nuts.
That's just crazy.
And we have the worst health outcomes. We're somewhere around like Slovenia and Azerbaijan. We're 37th at best in the world in outcomes. And we're spending like $4 trillion a year managing disease. We're not keeping people healthy, So that's starting to change too. This whole like drugs for everything, people are tired of it. They don't want that.
Yeah, I agree. I think it's definitely starting to change. I think probably a couple years ago, I was at a grocery store, and the grocery store obviously has like the pharmacy drive-through, and I pulled in and went to go park, and I'm like, what is happening? There's like 20 cars in this drive-through line. Like where is this going? Like, are people waiting to get out of the parking lot? They're in line for the drive-through pharmacy to pick up their prescriptions.
Oh, wow.
And it was like, for whatever moment, like that moment clicked to me, like, wow, like all of these people at least have one prescription, right? Some of them multiple.
If you're over 65, the average is 6.
Gosh.
It's messed up. It's messed up. It's like seriously messed up.
And it's one thing to fix probably another side effect of another medication, right?
Yeah, there's a knock-on effect.
Yeah. This whole polypharmacy thing is partly to manage the symptoms caused by the other drug. Right. So it becomes a terrible thing.
This can help your stomach pain that this other medication is giving you.
I had a patient came in taking, she was 64, female, was taking, I think it was 6 medications.
Gosh.
And she's like, I don't feel good. So something else we could do.
You're like, I bet. I don't feel good.
Let's try. Because again, drugs aren't bad; they're just overused. Totally. And there's a natural solution at least 95% of the time for anything anybody might be taking any drug for. Yeah. That's my conclusion, opinion. After doing this for a while, seeing many, many thousands of patients. And so she comes in. So she had a bunch of problems, digestive, respiratory, headaches, all kinds of stuff, hypertension, blah, blah, blah. So 4 months later, I started working with her. She's feeling so much better. And I was like, now, go to your doctor and say, hey, I feel better. Can I try less medication? How do I get off these drugs? Yeah. And so, because I can't manipulate a person's drugs, but their doctor can or they can. So she worked with her doc weaned off all the drugs within about 4 months. So 2 months later, she went in for her annual checkup, and the intake nurse, it's like, oh, nice to see you. I just want to review what medications you're taking. She says, oh, I'm not taking any medication. Oh, it's okay. You can tell me. This is confidential. She says, oh, no, I'm really not taking any. Ma'am, it's really important that I know. She's like, look, I'm a Catholic nun. I'm not lying to you.
Yeah.
I'm a sister in a religious order.
Yeah.
I'm telling you the truth.
I cannot lie, and I won't.
I'm not going to lie to you. I'm not taking medications.
Wow.
It's crazy. So, but the mindset, again, it's not the nurse's fault, but
Totally.
everybody's on a ton of meds.
Yeah, it's like, it's okay, just tell me.
Yeah. I was teaching a seminar in Phoenix, and there was a old-time acupuncturist there. He's in his mid-70s and practicing for 50 years. And the same thing happened. He goes in, and the nurse is like, the intake nurse is like arguing with him. Like, you have to be taking, you're 74.
Yeah.
And so she's like, finally, and he looked down on the chart. He wrote, non-compliant patient.
Oh my
Like, it was not even possible to her
Yeah.
that there could be a 74-year-old American male not taking at least one or more or 10 drugs. I mean, it's crazy stuff.
It is
so we have
crazy.
this drug culture,
Yeah.
which is so messed up, but it is changing. I'm very hopeful, and the tide is shifting.
What brought you into this? Because, we've kind of talked about this trend of people considering natural solutions or, remedies as sometimes a last bid attempt.
Yes.
They go through all these other solutions with pharmacology, with doctors and what have you, and then they go, okay, this isn't working for me.
Yeah.
But you've been practicing for a long time, right? You clearly got in at a young age.
I did.
What brought you in and saw this as a first option?
Yeah, well, I my first career was in music. I played the piano, and so I was a professional musician in New York for 10 years.
And amazing at it. We've heard you play, and you're fabulous.
I love to play, and it's a wonderful thing.
I don't want to derail the story. What genre do you...
Well, I was a church organist for those 10 years, but I also did like entertainment gigs, what we call club dates. So parties, restaurants, lounges. I taught piano, so I was an entertainer, basically recorded an album and was a church organist, which was kind of wild because, I play a Saturday night gig, get home at 3 a.m. and have to play a 9 o'clock mass.
Church the next morning.
I almost got fired so many times because the priest is standing there in the back, like, "Where's Mike?" Like, I'm waiting for him to announce the opening hymn. Please turn to 147, and we're going to do Holy, 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 whatever. And he's like, "Where's Mike?" So he was so angry. I mean, understandably, I'm supposed to be there before mass started.
Sorry, I had a gig last night.
Anyway.
It's awesome.
I shared interest, by the way.
So I like to use my hands, and music I love music. I love performing, but it got to be a little bit of a chore, and so it's like I'm a piece of furniture in a restaurant. Background music wasn't really my thing. It just kind of got stale.
Especially, I used to play in jazz bands and things.
That's right. That's right. What was your instrument again?
Yeah, trombone.
Trombone.
Yeah, and I started out in Dixieland, which is a great place to learn your instrument. And then moved into swing bands, like big bands.
Great.
But sometimes it's quite frustrating because a lot of like solos are improvised in jazz.
Totally.
So you might just do this really great line that is completely improvised right there, inspired in the moment, and it's background music because people. And it's like, do you not realize what just happened?
Did you hear that?
But all of us in the band go, "Man, check out what he just did!" And everyone else is like, you're kind of chatting away.
They're like,
completely missed a moment there, but whatever.
So it just got to be a bit of like, I got to lug the equipment in. So I got my first massage therapy treatment in 1987 at the Omega Institute in Rhinebeck, New York. I was there for a retreat, and I got my first treatment. Like, wow, this is like a professional, like you do. I'm like, oh, I'm really interested in this. So anyway, within a year or two, 1989, I ended up in school for massage therapy in a very holistic oriented school where they taught you nutrition. And you learn herbal medicine, you learn lifestyle and diet and cleansing practices.
Cool.
It was a very holistic school, New York College for Health Professions, and now it's in Syosset, Long Island. Wonderful school. And I was like, wow, I get to use my hands and help people because I want to do something to help. Like I was a music major after I was a psychology major. Okay. Because I wanted to do something to help people and I like talking to people. And so I thought I was going to be a psychologist. And at the time, I didn't really like school, so I'm like, I can't do this for 10 years to get a doctorate.
Sure.
I can't do it. And then I switched to music, and then I ended up in the health field. So started out doing that, and then in that school, their focus was really Chinese medicine. And I'm like, oh, this is good. So that's when I went on to more advanced training and aromatherapy, which is Asian body work, and then acupuncture, and just kept studying because Chinese medicine really appealed to me because it was a way to help people evolve. Yeah. It was about growth. It wasn't about, hey, let me stick a needle somewhere and make your headache go away. That's fine. But it had this background of coming from very highly evolved spiritual people who wanted to help other people evolve. Yeah. And I kind of like that. That resonated with me, kind of, consciously walking the spiritual path from a young age. Yeah. I was in my younger years, like 8th grade and into high school, I kind of had deep depression. Yeah. And so I was like, wow, I really want to do something to help other people, after coming out of that. So anyway, this is a way to help people and use my hands. And then I just loved Chinese medicine, so I kept studying. And then I learned functional medicine and nutrition and went more with that. And it's just been a beautiful journey. I've just been very thankful. And then I learned so much clinical experience and like really good success. I was like, I got to share this with her. I like teaching. Yeah. Ever since I was in second grade, it was the second grade would have been, would that be? It was communion, first communion, second grade, and somehow I ended up giving the second reading at the communion mass, like 2,000 people in the church. Wow. Yeah. And my mom was sitting there. She's like, you weren't nervous at all. This little kid, awesome. Maybe it was 9th grade. I was about 9. Yeah. And he's like, you just went up there, and it's like you were just so natural. She said something like, you looked like you belonged there.
Oh, that's cool.
So I just speaking. I just enjoy sharing through the spoken word with people and written too. So, it's been a great journey.
Yeah. You can tell you're passionate from the way you talk about it. I think I've never maybe put 2 and 2 together, but that would be cool, kind of walking this holistic journey with people, because that doesn't really happen in traditional medicine, right? You don't go to the doctor and say like, oh, I can't wait to see him again. It's kind of like, let me do whatever I can to stay away. Right. But once you get bit by this kind of holistic, natural way of healing yourself, the bug, so to speak, it does kind of evolve.
It does. Well, and back in the day in ancient China, you paid your doctor a salary. Yeah. And he got paid as long as you were well.
Oh,
and
interesting.
if you got sick, you didn't get paid until you got better. So there was even a financial, like a healthy capitalist incentive.
Shouldn't we swap it back?
That's a good way to do it.
So it was in the doctor's interest to keep you healthy.
Yeah. Interesting.
And if you got sick, to get you better fast, because you fell down on the job.
Sure.
Because in Chinese medicine, the superior physician promotes people's growth and evolution. The medium physician prevents disease, so it keeps you from getting sick. And the inferior physician treats disease.
Interesting.
Right. So in other words, I just wait till you get sick. Yeah. And then, we'll fix you up. So that was considered very inferior medicine to help someone just basically fulfill their potential or destiny, their Ming, as we say in Chinese medicine. Help the person fulfill their potential in life was the highest form of treatment. So it's a totally different scene. So I like that.
For sure.
So that's kind of how we work today.
You also seem to be a perpetual learner as well. Like
there's so much to learn.
Constantly studying, reading, learning, becoming.
Yes.
And I love... I was taught years ago, teaching is the higher phase of learning. And
sure.
I've always felt like I don't know a point well enough if I can't teach it to someone else.
Yeah, 100%.
Yeah. Yes. So I just a little sidebar, interesting snippet here. But educational psychologists have said that you actually learn at an accelerated rate if you learn with the intent of teaching others.
That makes sense.
Yeah, so often that's kind of what I do
that
a lot,
would explain a lot.
I read with the intent of teaching it to someone else.
Yes.
And it just, partly because it helps me retain what I'm learning, because again, if I can teach it to someone else, then I get it.
Right.
Yeah.
And if I can't, then I haven't learned it well enough yet.
Yeah, that's awesome.
But it does accelerate the learning process.
Well, because you have to organize your thinking. If I'm going to explain this to you, I have to have those thoughts organized in a way that I can express clearly.
Sure. Yeah.
So that forces you to like digest whatever that is and be able to share it. And then the next step is to be able to share it in very few words.
Yeah.
I know.
Right.
Yeah.
That's like an economy of word. That's one thing I learned from having studied with so many teachers. The ones who were the best didn't say a lot.
Yeah.
They were able to express something in very few words, which indicated their mastery of that subject.
Totally.
They'd fully embodied it, digested it, it's in them. And
there's nothing worse than a college professor that says so many words about a subject you don't care about. Right? You're like, oh boy.
Simplicity is at the far end of complexity.
Yeah.
Totally.
I think it was Emerson that wrote to Thoreau and said, or it was Thoreau wrote to Emerson. And in the letter, he said, we must simplify. And he wrote back, I think one would do.
That's awesome.
Busted.
That's so funny. That's so great.
Oh, I love that.
Out of interest, what does you seem like you're very into this holistic way that you're teaching for everyone else, for yourself for sure. Yeah. What does your routine look like, out of curiosity? What things have you kind of been into? Are you into the sauna? Are you into?
And it's evolving. When I realized, because I teach functional medicine full time, so I have to be kind of on my game, up to date with research. Be clear, to keep evolving. Some students have been with me for 7 years. In our functional medicine program, and they still keep coming back because they're learning new things. From just recycling, and I saw that with some of my teachers, like they retired and they're just going to tell you stories from 20 years ago over and over again. It gets a little stale. So that's why one of the reasons I keep practicing. But for myself, and part of the reason I got into this was that I had a lot of health issues myself. I went through some pretty severe depression when I was younger. 11, 13, 17, around those ages. But then after that, I had all these health issues, digestive problems mostly. I'm like, what the heck? So thankfully, I got into massage school and this holistic school where it helped me clean up my diet and do more exercise and take care of myself better. And so that kind of got my attention, that lifestyle matters. So my current routine is, on good days, because I have my kids half time, and so I like to have meals together. So I like to, when I don't have them, I only eat 2 meals a day, intermittent fasting, eat all my food in 8 hours, sometimes less, and then just water the rest of the time. It's a very powerful thing for me. And then I kind of blow that. Well, we'll have breakfast together, and I'll make pancakes, and it's out the window.
Sure.
But anyway, I try to do intermittent fasting most of the time. As a nutritionist, one of the most powerful recommendations I make to patients that really got my attention. My sister, from doing that, lost 60 pounds.
Wow.
And 30 inches on her waist. She was obese in 2.5 years without changing her diet, doing intermittent fasting. She actually went beyond that. She eats a 4-20. So she eats one meal and then a snack, and she's done.
Wow.
And she just water the other 20 hours of the day.
Wow.
And she just stays, she's lost like, a dozen dress size, whatever it is.
That's crazy.
It's amazing. 30 inches. I mean, and she didn't change her diet. She just eats in
different
this little
times.
windows. So call it time restricted eating. So that's one big thing. I love, I continue with my martial arts practice. I was away for a while. I really missed it. So that really helps me. It's a very fitness-oriented gym, dojo. So we're doing a lot of like body weight exercises and calisthenics and fitness things and drills, and so that really helps me a lot. And then, I live in a community, an HOA that has a pool. So I'm in the pool most days doing laps. And then I got a little dog, and I walk the dog. The neighbor, I try to get outside every day in the sun. That's very important.
100%.
And then diet-wise, it's not a perfect diet, but compared to what it used to be, it's a lot better. I mean, when I was a kid, my brother would come home from his job with like a bag of Starburst, like 20 packs. They'd be gone in 2 days. It was just like I achieved the color. I could. My friends did this with me a couple of times. They did a blindfold taste test of gummy bears, and they would feed me gummy, and I would accurately, reliably tell them
what color,
what company it was.
Oh my gosh!
And where it was made. It was crazy. I mean, it's just nuts. So like that's how we achieved the colorful diet, was eating, all this fruity candy.
Not vegetables or fruits.
So I've come a long way from that. But anyway, I try to really, I just feel better on a very high protein, high fat diet.
Yeah.
So lots of grass-fed beef and organic poultry and sausage, bacon, and vegetables and fruits. So it's so again, I cheat sometimes, I get off course, and I feel it, I notice it. But I try to stick to that.
Yeah.
Kind of meat and vegetables, martial arts, intermittent fasting.
Totally.
Regular exercise, that really helps me out a lot.
It's the core stuff that we all, in our heart of hearts, really already know, right?
100%.
It's mobility, it's action, it's activity.
Yeah.
It's moderation.
Yes.
It's good sleep. It's great
Sleep
hydration.
is a big one,
And BEMER.
And BEMER, yeah.
But I totally tell the difference if I'm not hydrated enough and if I'm not using my BEMER.
Yeah.
Oh, I notice it.
Yeah.
It's crazy.
If I go too long.
Yeah.
Yeah.
For sure.
Well, Dr. Gaeta, it has been a thrill having you in the studio today.
Thank you.
Great
So
being with
I
you.
got to make one more point.
Of course.
On the BEMER, we have two circulatory systems, the blood circulatory system and the lymphatic circulatory system. And we have roughly as many, some say more, some say less, as many lymph vessels as we have blood vessels. So I went into this a little deeper since getting acquainted with the BEMER about 2.5 years ago, almost 3. And I was like, wow, let me go a little deeper dive on this. Just as with microcirculation, I learned a little bit in school, but now I know a lot.
Yeah.
Because of this device. So what I learned was the lymph vessels are built the same as the blood vessels. They have the same structure, same anatomy, you would say, as the blood vessels. The only thing that's different between a lymph vessel and a blood vessel is what's in it. So lymph, which is basically interstitial fluid between the cells, collects in the lymph vessels and goes in and out. And what's in the blood vessels is blood. That's really the only difference. So this is where it gets wild. Since the smooth muscle surrounding and the pericytes, PERI, meaning peripheral, cytes means cell, which surround the capillaries, it's the same in the lymph vessels. So the BEMER is a lymphatic circulation treatment equally as much as a blood circulation treatment. Which is wild because its lymphatic system is really important.
Totally.
Fat transport, detox, circulated immune system, and a lot of other things. So the fact that we're influencing the same stuff in the lymphatic system, the same mechanisms, which is the smooth muscle, the pericytes, the glycocalyx, the nitric oxide, all that stuff is happening in the lymphatic system. That makes the BEMER like extra crazy, awesomely special, because you're doing a lymphatic treatment equally as you are a blood circulation treatment. Big stuff.
If that is not a teaser for another episode.
Yeah, seriously.
What is?
Wow, we drop it at the end. That's crazy.
Huge. That's huge.
That's awesome.
That's what I said.
Yeah. Man.
Well,
we need to book another hour and fast.
Yeah.
Will do.
Yeah. Let's
Love
do it.
talking to you too. You folks are wonderful, and I appreciate all you're doing to help the family.
Yeah, well, we love having you on.
Yeah.
Such an easy conversation every time we speak. It really is.
It's awesome.
But so much to take away. Thank you all for being with us, and thank you, Dr. Gaeta, for coming along.
Thanks for joining us. Thank you so much. We'll see you guys later.
Again.
You bet.
Take care, everyone.